Hey guys, this is Dr. Hub. Now we are going to look at the steatosis and we are going to compare the microvesicular versus that of the macrovesicular. So first, let's just focus on the microvesicular. The microvesicular, it includes the acute fatty liver of pregnancy, next there is also the presence of the Rey syndrome, then comes the alcoholic foamy degeneration, next there is also the drug and toxin induced injury. There is drug as well as toxin induced injury. So what does this include? There is presence of the valproic acid. Next comes the presence of the salicylates. Then there is the parenteral tetracycline as well as the hypoglycine A. So in the drug and toxin induced injury, there is valproic acid, there is salicylates, there is parenteral tetracycline and hypoglycine A. Next we also have the congenital metabolic conditions. So what does the congenital metabolic conditions include? So this includes the presence of the urea cycle. Then there is also the disorders. Next there is defects in the fatty acid. It is in the fatty acid metabolism. Then comes the deficiencies, and this is in the lysosomal acid lipases. Next, we will move on to the macrovesicular steatosis. So in terms of the microvesicular steatosis, there is a centrilobular predominant. There is a division of the centrilobular predominant, and this is nothing but the zone 3. So what is included in the centrilobular predominant? So this includes the presence of, there is obesity as well as there is NASH. So what is NASH? NASH is nothing but the non-alcoholic steatohepatitis. Then comes the presence of the late alcoholic liver disease. There is a late alcoholic liver disease. Then comes the diabetes mellitus. Now we look at the periportal predominant. So under the periportal predominant, we look at the zone 1. So what does the zone 1 include? There is the TPN. TPN means the total parenteral nutrition. Next, it also includes the AIDS. This is in zone 1. There is presence of AIDS, that's the acquired immunodeficiency syndrome. Then there is also the inclusion of the phosphorus poisoning, and there is exogenous steroids. Next, it also includes the starvation as well as the chronic hepatitis C.